There's a unique kind of silence in a house shared with an old cat. It's a quiet filled with memories of midnight zoomies and years of gentle purring. We often wish our feline companions could stay with us forever, but as the years pass, the rhythm of their lives begins to slow down. Today, we're having a difficult but deeply necessary conversation. We're going to talk about the quiet signs that a cat is preparing for their final journey. Understanding these signals isn't about dwelling on sadness. It's about love, responsibility, and ensuring our best friends have a peaceful, dignified, and comfortable farewell. Hello everyone, it's truly good to have you here today. On this channel, we strive to be the voice for those who speak to us through soft blinks and gentle headbutts. The topic of a pet's passing is something many of us try to push to the back of our minds while our kittens are still chasing shadows. But knowing how the aging process works is an act of compassion. It allows us to recognize when a cat needs medical intervention to stay comfortable, and when it's time to simply hold their paw. Today, we'll walk through the 6 key indicators that a senior cat's body is beginning to let go, and how we can support them every step of the way. To start, we have to ask, when does a cat actually become senior? Age, after all, is just a number, but in the feline world, that number matters. According to the American Association of Feline Practitioners, a cat enters their senior years between the ages of 11 and 14. Before that, from age 7 to 10, they are considered mature. Still vibrant, but perhaps a bit more selective about which toys are worth the pounce. Once a cat passes 15, they enter the geriatric stage. These are our precious golden oldies. It's worth noting that genetics play a huge role here. Our larger friends, like Maine Coons or Persians, might start showing signs of age a bit earlier due to breed-specific health predispositions. Meanwhile, many Moggies, our wonderful mixed-breed cats, or lithe breeds like Siamese, are known for being incredible centenarians of the cat world. One interesting fact to keep in mind, indoor, spayed, and neutered cats tend to live significantly longer. By removing the urge to roam, fight, or hunt in dangerous areas, we've essentially given them the gift of a much longer sunset. Understanding where your cat sits on this timeline helps you filter what is normal aging and what is a distress signal. But even if your cat is 20 years old, their behavior is always a better barometer than the calendar. And usually the first thing we notice is the food bowl. In the veterinary world, a sudden loss of appetite is one of the loudest alarms an animal can sound. For a senior cat, interest in food might wane gradually, but if the bowl remains untouched for more than 24 hours, it's a medical emergency. You see, cats have a very specific biological quirk. When a cat, especially an overweight one, stops eating, their body tries to process fat stores far too quickly. This can lead to a life-threatening condition called hepatic lipidosis, or fatty liver disease. Sometimes you'll see a cat approach their food, sniff it, and maybe even lick their lips, but then walk away. This isn't pickiness. It's often a sign of nausea, dental pain, or a profound internal weakness. In the final stages of life, the digestive system begins to shut down, and the body no longer requires the energy that food provides. It's a heartbreaking sight, but it's the body's way of focusing its remaining strength elsewhere. While food is important, water is even more critical. Dehydration is a silent and persistent thief in older cats. You can perform a simple check at home called the skin turgor test. If you gently pinch the skin between your cat's shoulder blades and it doesn't snap back instantly, if it stays in a tent or drifts back slowly, your cat is dangerously dehydrated. In a healthy cat, the gums are pink and moist. In a cat whose systems are failing, they become dry, tacky, and pale. Usually, a day or two before passing, a cat may stop drinking entirely. This leads to a buildup of toxins in the blood as the kidneys lose their ability to flush the system. If your senior kitty is still fighting but struggling to drink, you might try offering water from a teaspoon or setting up a fountain. Sometimes, the mere sound of running water can spark a primitive instinct to take just one more sip. As hydration and nutrition fade, the cat's physical presence seems to diminish as well. There is a profound difference between a cat losing a little weight and feline cachexia. Cachexia is a wasting of the body where muscles literally melt away. You'll feel every vertebrae along their spine, and their shoulder blades will stand out like tiny wings where there used to be soft fur and muscle. This often happens alongside chronic kidney disease or hyperthyroidism, common companions of the aging cat. The body begins to consume its own muscle mass just to keep the heart beating. When you pet your friend and realize they feel more like a skeleton covered in silk than the sturdy hunter they once were, it's a sign that their internal resources are nearly spent. At this stage, they lose the ability to regulate their own temperature. They will seek out warmth, and providing a soft, heated bed can be one of the kindest things you do for them. These physical shifts almost always lead to changes in personality. Every cat handles their final days differently, often reverting to ancient instincts. Some cats will seek total isolation. In the wild, a sick animal is a target for predators, so their instinct is to find a dark, quiet, inaccessible place. Under a bed, in the back of a closet, or deep in a basement. If your normally social greeter has suddenly moved to the laundry room and refuses to come out, they are telling you they feel incredibly vulnerable. On the other end of the spectrum, some cats become intensely clingy. They might follow you from room to room, crying out if you leave their sight. They are seeking comfort and safety in the person they trust most. Whether your cat is hiding or hovering, the best thing you can do is meet them where they are. If they want to be alone, don't drag them out. Just place their water nearby. If they want to be on your lap, let them stay. Your presence is their greatest anchor. There are also signs you can hear. A healthy cat breathes quietly, about 20 to 30 breaths per minute. As the heart or lungs begin to struggle, that rhythm changes. You might notice their sides heaving or their breathing becoming ragged and wet. This crackling sound happens when the body can no longer clear fluid from the lungs. You can also check their circulation by looking at their gums. If the gums have a bluish tint, it's a sign they aren't getting enough oxygen. If they look yellowish, the liver is likely failing. Heart rate might skyrocket as the heart works overtime, or it may drop to a very slow, faint thud. These are the technical details of the body's closing ceremonies, and they tell us that the journey is nearing its end. As the heart slows down, the extremities, the paws, the ears, and the tail, will become cold to the touch. The body is redirecting all its remaining warmth to the core to protect the heart and brain. You'll also see a change in their grooming habits. Cats are notoriously clean, but a dying cat simply doesn't have the energy for a bath. Their fur may become matted or spiky, and you might notice their eyes looking dull or sunken. Sometimes the third eyelid, that white membrane in the corner of the eye, will drift halfway across, a clear sign that the body is exhausted. Finally, we have to talk about the things that are hard to witness. The loss of litter box habits. It's never about spite or forgetting. An old cat may have severe arthritis that makes stepping into a high-walled box agonizing, or they may simply lose neurological control. If your cat has an accident, please don't be frustrated. Simply place absorbent pads in their favorite sleeping spots. At this stage, your patience and your lack of judgment are the ultimate gifts of love. I know this is a lot to take in, but remember, not one of these signs on its own is a definitive end. They are cries for help. If you see these symptoms, the first step is always a call to your vet. Sometimes what looks like the end is actually a treatable condition, or a type of pain that can be managed. We have the incredible tool of palliative care. We can provide pain relief, hydration, and comfort that ensures their final days are spent in peace, not in agony. And if the time comes to say goodbye, being there, holding them, talking to them in the voice they've known since they were young, is the final act of a beautiful friendship. Growing old is a natural part of life, and our cats deserve to do it with dignity. We brought them into our homes as tiny balls of energy, and we promise to look after them. Fulfilling that promise until the very last second is the highest form of love there is. Take a moment today to give your kitty an extra scratch behind the ears. And tell us in the comments, how old is your senior cat? What are your favorite memories of their younger years? Sharing these stories helps our community remember that we aren't alone in this journey. If this video helped you understand your friend a little better, please give it a like and subscribe. We'll continue to explore the wonderful, complex world of cats together. Until next time, cherish every purr, and may your cats live long, happy, and peaceful lives.